Greetings, everyone. Welcome to the session on promoting inclusion in the workplace and in the research process. I'm Ron Saunders, a member of the DWC Steering Committee. As you might guess from the title, this session features two quite different presentations on two different projects, but each of these presentations relates to the theme of promoting inclusion in a different way. The first project that we're going to hear about provides a systematic review of qualitative research on barriers and facilitators arising from work disability policy to the employment of individuals with chronic physical illnesses. This presentation will be given by Dr. Sandra Small, a professor at Memorial University in St. John's. The other presentation, for which we have two speakers, describes how to integrate in the scientific process the lived experience of people with disabilities along with researcher expertise. This draws on a multi-year partnership between researchers at the Institute for Work and Health and the Canadian Arthritis Patient Alliance. We have Arif Jetha of IWH and Laurie Proulx of the Canadian Arthritis Patient Alliance who will jointly present this part of the session. We're going to begin then with the presentation from Dr. Small. Sandra, over to you.
Okay, good afternoon. This presentation is about a systematic review of research concerning workers with chronic physical illnesses and their experiences with work disability policies. During the presentation, I will briefly discuss the objective of the systematic review, the significance of the problem, including defining the main concepts, the methodology for the systematic review, including the study selection and inclusion process, characteristics of the included studies, and synthesized findings, along with some recommendations around the more prominent findings. The objective of the systematic review was to identify and synthesize the best available evidence concerning the perspectives of individuals with chronic physical illnesses in relation to barriers and facilitators experienced at the work disability policy level with respect to labor market engagement. And I will be focusing on barriers only in this presentation. Chronic physical illness is defined as any physical disease of long duration that may cause limitations in daily activities, can be treated but not cured. There are many different such conditions, the most common of which are various heart diseases, cancers, respiratory diseases, diabetes, arthritis, among others. Such conditions have a high and increasing prevalence worldwide and are associated with significant disability in the working age population. So it's not surprising then that they are also associated with low employment, high unemployment, and low wages. Work disability policies refer to guidelines and rules pertaining to non-monetary benefits, supports, and financial compensation relative to work, employment, and integration into the workforce for individuals with disabilities. And sources of such policies may be government programs, private disability and pension plans, disability and accident insurances, trade union agreements, and employers. Generally, aims of such policies are to provide for income to those who cannot work and supports for those who can work, such as wage replacement or accommodations in the workplace. However, despite a main purpose of work disability policies being a facilitation of labor market engagement, inadequacies of such policies may pose barriers to work engagement for individuals with disabilities. Therefore, it is important to understand work disability policy barriers to labor market engagement from the perspectives of those affected. And in this case, that would be individuals with chronic physical illnesses. The systematic review was conducted using the well-established methodology of the Joanna Briggs Institute, as illustrated on this slide. The study selection and inclusion process for this systematic review, as illustrated here, indicates that some 1,600 documents were found through the academic databases and gray literature sources, the vast majority of which were eliminated because they were not at all relevant to the topic of the review or were not consistent with the inclusion criteria for this review. And some were eliminated on the basis of methodological limitations, such that we ended up with 43 studies in the review. The studies were of various qualitative designs, mostly qualitative descriptive, variable methodological quality. There were a number of different chronic physical illnesses represented across the studies. Most commonly were cancer, stroke, HIV/AIDS, multiple sclerosis, and arthritis. The sample sizes across the studies ranged from 3 to 50 participants for a total of approximately 760 participants across the studies. There was a broad range of current work statuses, from full employment to being on disability and Social Security benefits. And the studies originated in 12 different countries. In terms of the findings, the 43 studies yielded 270 study findings, 150 of which reflect challenges experienced in relation to work engagement. And these challenges were further grouped into 3 synthesized findings as illustrated on this slide. Workers perceived barriers to labor market engagement relevant to work disability policies directly, but also they perceived barriers to labor market engagement relevant to stakeholders' help and support towards workers' efforts to engage in work. The stakeholders they referred to are employers, insurers, and healthcare providers. Barriers were in relation to returning to work after being on leave due to illness, and in relation to sustained or ongoing work engagement. Furthermore, workers thought that work disability benefits negatively impact workers because of benefit drawbacks and negatively impact work engagement through workers not working or not working full-time to protect their benefits, especially their health benefits. So more specifically then, barriers to successfully returning to work were work disability policies that failed to meet workers' needs, lack of help from stakeholders in navigating the process of returning to work, inadequate informational and programmatic resources, inadequate communication within the stakeholder system, lack of support from healthcare providers, pressure from employers and insurance companies to return to work, not having individual needs taken into consideration by insurance companies, and resistance by employers against return to work. And this list is in order of how common these findings were across the studies. And all of the findings were supported by quotations from participants across the studies, such as this one about the failure of policy to meet needs. That's all they allow, 1.5 weeks of leave. The company is very strict about their employees coming to work, and they tell you every day, there are 3,500 people waiting for your job. So if you're not going to be here, we'll hire one of those. Barriers to sustained work engagement consisted of lack of appropriate accommodations for work and unsatisfactory medical advice. And this second barrier was reported by a relatively few number of participants. As one participant stated in relation to lack of accommodations, there was no give at all. I wasn't allowed time off to go to outpatients. I had to book a day's holiday or arrange my duty around it. I had to do as many night duties as everyone else. In terms of work disability benefits, the drawbacks that workers experienced were mostly in relation to work accommodations and sick leave. Although accommodations and sick leave were considered to be helpful to being able to work, Workers had concern about others' negative reactions toward them, such as others thinking they were getting special treatment or thinking they were taking unwarranted advantage of the system. And workers also felt guilty about their request. Some workers thought that accessing accommodations could compromise their future job promotion or job security, as it could cause the employer to doubt the worker's ability. As well, workers were concerned that accommodations could interfere with privacy when disclosure of illness is required. Furthermore, workers thought that although seniority policy could advantage some workers for certain accommodations, it could disadvantage those with a short work tenure, as they may not be able to access a job or work assignment suited to their condition, or they could be bumped out of a job by a worker with more seniority. Workers also talked about being hesitant to attempt to find work, actively deciding not to return to work, or deciding to work only part-time to avoid losing their benefits. In other words, they were afraid of losing the security provided by the benefits. This quotation illustrates disability drawbacks. So I had this graduated return, and one day when I was leaving at 2 or 3 in the afternoon, my coworker is like, "Are you actually leaving? Like when everyone has all of this work to do, you are actually going to walk out of here at 3 o'clock." Another worker talked about not working to protect disability benefits. "I'm on disability, and sometimes I think it would be neat to be back out in the world. I love to be around people, but I really don't want to jeopardize my disability money. The what ifs are strong. What if I get sick? What if I'm late 2 or 3 days?" There are several recommendations coming out of the findings in this review, albeit they're not unique in that similar recommendations have been well documented in the literature. Examples based on some of the more commonly reported challenges workers experienced are: work disability policies should provide for adequate income and benefits to cover illness and disability costs for individuals unable to work, and good financial incentive and supports to assist those who have work capacity so that they may engage in salaried work. Stakeholders should be flexible in administration of policies, and especially accommodations and sick leave were noted by the participants in this study, so that the flexibility then could take into account the unique needs of individual workers. Workers with chronic physical illnesses should receive professional assistance, such as through a navigator, a case manager, or a coordinator, to help them access relevant resources and policy benefits, and to communicate with stakeholders, and also assistance to coordinate their work engagement. Employers should have workplace policies that promote a supportive work environment for workers who need accommodations and sick leave. Healthcare to individuals with work disabilities should be a multidisciplinary team approach with health professionals who are specialized in occupational health and in the management of work disability. These are some references that I used for this presentation. And thank you very much.
Thank you, Sandra, for presenting those extensive findings. So now we're going to turn to the second presentation by Arif Jetha and Laurie Proulx, and I believe Arif is going to kick things off. Over to you, Arif.
Thanks, Ron. And so just to remind you, my name is Arif Jetha, and I'm a scientist at the Institute for Work and Health based in Toronto. And so today, myself and Laurie, who will introduce herself shortly, will be presenting on a collaborative approach to research on inclusive work environments and the importance of an integration of lived experience and academic insights in the research process.
Right, thank you, Arif. As you said, my name is Laurie Proulx. I'm happy to be here today to speak with Arif about this important topic. I'm on the executive of the Canadian Arthritis Patient Alliance, which is a patient-driven and managed organization with members across Canada. I also live with juvenile idiopathic arthritis, a condition I was diagnosed with when I was 14 years old. So in terms of what we'll be talking about today, there are a number of objectives noted here on the slide. The first being how to foster a collaborative, collaborations among researchers and people with lived experience, why this collaboration is really essential to the research process, how we maintain that over the course of several years, as well as providing some practical examples of research products, as well as how the findings have been translated for different audiences.
And so our presentation is rooted in an integrated knowledge transfer and exchange approach. And this approach has become an essential element of health research in Canada. And so the Canadian Institutes for Health Research describes the importance of an integrated knowledge transfer and exchange approach, which they define as the inclusion of consumers or people with lived experience in all aspects of the research process from start to finish. And so through this approach, it's thought that research will be more relevant to knowledge users and be more likely to be utilized in practice. And other scholars note that the integrated knowledge transfer and exchange approach should be a two-way exchange of information between both researchers and stakeholders that includes prolonged and meaningful engagement as well as capacity building.
Right, and beyond the benefits to the research process, it's also about providing a voice to people with disabilities in research. And I think this is summarized really well through disability rights philosophy of nothing about us without us, which represents a broader call for the inclusion of disabled people as they have been so often left behind. Unfortunately, we have experienced discrimination and stigma in the workplace that has affected our participation in all aspects of life, including work. And these perspectives can bring powerful insights to research and contribute to developing new research questions that are relevant to our community. So in terms of how we established and maintained our collaboration over time, in terms of making the connection, the first box on the left, I actually met Arif going back to 2016 or 2017. So we've actually been working together for quite some time. Coincidentally, in my day job, as I often like to call it, I work in human resources. And honestly, before I had met Arif, I never really thought about the link between research and work. And so I was actually quite excited to see how I can merge some of my regular work with my contributions to research as a patient partner, as well as my work with CAPA. So he asked if I'd be interested in contributing to his research, which focused initially on the experiences of people with rheumatic disease across the life course. So this was the beginning of our work together.
Yeah, and so to expand on this, we describe this like reciprocal relationship where we started off with that small project that Laurie just described. And I think this was a really good test for us to see if this collaboration was truly mutually beneficial. So it wasn't just one of us getting something from it. And I think of this process kind of like research speed dating, where we wanted to see if it was the right fit. And so through this initial collaboration, we began to think of new and novel research questions, and this was integrated into several research grant proposals as well as papers. And Laurie quickly became an important member of our research team where her views were incorporated into all aspects of our scholarship. And I think Laurie was often key to informing approaches to dissemination of results, especially to key knowledge users. And as mentioned, this process of engagement is really reciprocal and has really led to more and new research ideas that we've generated over time.
Right. So in terms of why, we think a collaborative approach is essential, from the lived experience perspective or my perspective, I think we have a lot of expertise to offer to research that relate to some of the practical day-to-day challenges that we face. And I think Sandra sort of covered off some of those challenges well, I think, and I can relate to many of them in the initial presentation. Things like difficulties in accessing, accommodations or some of the stigma or attitudes of managers or co-workers. And all this is really important to ground the research into some of these day-to-day realities. Researchers, or as Arif has mentioned, it's sort of a two-way process, have something to offer people with lived experience as well, their expertise and access to information that help guide actually some of the projects that we launched with CAPA, or the Canadian Arthritis Patient Alliance. So this whole project actually was inspired by our collaboration together, and I'll describe a little bit more about what that that entailed later on. But and in addition to that, we can also provide some practical advice or help on ensuring that materials or communications are easy to understand and are helpful for our community. And this has implications for study design, for recruitment, and can actually help with retaining study participants. As well, going the other way, I asked Arif to write an article for the Kappa newsletter, for example, to convey some of the research findings to our community and to people living with rheumatic diseases.
Yeah, and so obviously the lived experience is critical to informing the research process, and Laurie really highlighted how she was able to really insert that into our research. But in addition, I think an asset of collaborating with Laurie has been the practical considerations on data collection approaches that we've been using. And so she's often the voice in the room to let us know if, for instance, if survey questions make sense, or they provide or she also provides insight on data collection as well as what works and what doesn't. So an example of this is we launched an online survey for people with arthritis where respondents could use a digital slide bar to rate a pain score. And Laurie noted that this format of response options could be challenging for people who face limitations moving a mouse from side to side. And so we adapted that question to reflect Laurie's considerations. Importantly, once we've collected data, Laurie often has interpreted the findings from the perspective of both a person with lived experience as well as a leader of a patient-led advocacy group. And accordingly, she offers important insights to help us understand what findings practically mean from different perspectives. And lastly, working with Laurie has really helped us identify important knowledge and mobilization outputs that are relevant to end users that go beyond scientific articles that many researchers don't often think about. So it's been really valuable in that sense as well.
So in terms of what worked well working with Arif and our multi-year collaboration is how well organized and thoughtful he was in the engagement. It's important to consider inclusive practices, like the times of meetings might mean that I can or can't contribute to the fullest. And even when reviewing the themes from the qualitative study, which was our first piece of work together, he had organized a slide deck that outlined some of the key themes and even provided supporting quotes to those. And it just helped me wrap my head around themes and identify if anything might need to be interpreted differently based on my lived experience in the workplace. Also, because of the ongoing communication, and I was sort of, felt like really part of the team and I was included all along the way, it was really clear to me when my feedback was incorporated or not. I can appreciate that not every piece of advice will be used, but in our discussions, I could understand why. And of course, in other situations, I could see the impact of my advice more clearly in the next version of the document. Also, I was able to connect, Arif with other arthritis organizations and patients. For example, I connected him with a health charity that supports children and youth with rheumatic disease. And they also became part of a follow-up project, and it led to a larger collaboration with them and their youth leader network. I've also engaged some young adults with JIA on the Kappa board in reviewing some of the, and some of the outputs that he's worked on.
And so from my perspective as a researcher, I thought there were several activities that we engaged in that really fostered a good collaborative relationship. The first was really maintaining regular communication across the research process. And this meant that Laurie could have opportunities to provide regular feedback throughout the research. And I think it's a mistake to only have feedback at the beginning or end, because it could end up feeling like it's tokenistic rather than true meaningful integration into all aspects of research. I think also effective or practical tests of research materials or formal conversations where Laurie could then describe what works well and what doesn't in terms of our data collection approach. Also walking through the process of why research decisions were made so that Laurie had the capacity to offer meaningful feedback. And finally, again, just reiterating the fact that collaboration should be two ways. And that meant not only is Laurie providing insight into the research, but I'm also providing insights into some of the activities that her organization is initiating.
Right. And I've actually, been involved with, a number of different research projects beyond, working with RF. So in terms of some broad, advice for including people with lived experience in research, I think it's really important. And I know it may seem common sense, but on the other hand, I haven't seen it always put into action. It's to really see the whole person and their priorities. To use myself as an example, I have a regular job, I'm a parent and spouse, and I manage a complex chronic illness that takes up a lot of my time. So this really needs to be considered when planning for collaborating with people with lived experience. Our realities are often different, and this is not our regular job sort of on top of it. What this means is actually you need to accommodate them, much that we, focus on accommodating people in the workplace. It's a similar concept, right? Working around their schedules, reimbursing expenses or support costs that they may have, like childcare or attendant care, making sure we pick, when we can actually go back to physical places, accessible spaces. And that really supports their full participation in the project. On the opposite end of the spectrum, I've seen, ad hoc inclusion where there isn't a lot of that planning, and I haven't seen enough equity measures or supports put in place to support the engagement or collaboration, or it's sort of one-sided, meeting the needs of the research team and not sort of the needs of everyone. And I've also seen, unfortunately, situations where contributions aren't being recognized, whether it's excluding them, as authors and publications, not that it necessarily matters, but it's a signal that shows that you're really part of the team, or, providing an honorarium to support their contributions because they might be taking time away from work, for example, if they are actually able to work, and obviously a vulnerable population to begin with. In terms of the honorariums, just a special note there that, if disabled people are accessing income supports, you'll need to find other ways to recognize their contributions, or possibly, and they'll need to be discussed with them to ensure that they're not worse off financially.
Yeah, these are really good points, Laurie. And I think from my perspective, there's some tips that I would think should be avoided. And I think expecting engagement without capacity building can be a mistake, especially in a collaborative research process. So oftentimes in our meetings, some of the first aspects or the first few slides in a meeting presentation will be a plain language description of the research methodology we plan to use. And I think also, like, through prolonged collaboration, not just one specific project, a person with lived experience can gain more confidence in getting involved with research and getting involved and like understanding some of the lingo that researchers often use, as well as researchers often getting more in tune to some of the lingo that those with lived experience might be engaging with. I think it's also important not to expect that a person with lived experience will be able to interpret complex data outputs, especially individuals who might not have formal research training. And so, for instance, I've never really expected Laurie to be able to interpret a hierarchical regression model output. But at the same time, like, to Laurie's credit, she's taken a number of steps to gain expertise in quantitative research. And in fact, she's actually taking a graduate diploma course in clinical epidemiology, which shows her desire to get more involved and provide more meaningful contributions to the research. At the same time, I acknowledge that Laurie is a volunteer, and while she might get compensated for her time in certain cases, she has a day job, a family, and other demands. And I think expecting her to devote a large amount of time to research projects would be a big mistake and something to avoid. So with that being said, I think it's important to highlight that our collaboration has really led to some really interesting and amazing outputs. And we just wanted to just end this presentation by just showing off some of these outputs. So first and foremost, from a researcher perspective, obviously these are important, and Laurie's been instrumental to our research process, and she's been included as a co-author on numerous publications that we've authored. And she's provided feedback on manuscripts, especially with discussion and introduction sections where she can really insert that lived experience.
Yes, and as I mentioned, this collaboration with Arif has actually led to the creation of a project for CAPA, not really, having experienced, a research focused on the workplace for people with arthritis, we decided to do our own project on arthritis in the workplace. So starting with the development of a survey, which, Arif was, one of the reviewers, had reviewed the questions. Also in terms of developing the resources that would support people with arthritis and try to further support their participation in the workplace. So he provided some of the research findings from that and also reviewed the resources, which you can see there on the left-hand side, and they're available on our website here noted. As well, it led to sort of a broader community engagement activity for CAPA, where we held a Twitter chat, and it was actually held on World Arthritis Day because there's been a focus, internationally on arthritis at work and how do we better support people. So we actually partnered with some international colleagues, Creaky Joints, which is a patient group in the United States, and Simon Stones, who's a patient and advocate and blogger in the United Kingdom. And we co-hosted a Twitter chat last year to engage our community on workplace issues. We had over 3 million impressions, 110 participants from like a range of different countries, and over 500 tweets in the span of an hour.
And just more recently, through our collaboration, one of the things we realized is that a lot of the resources for people living with rheumatic conditions are tailored to middle and older aged adults. And so what we decided to do was develop a tool that's actually funded by CRWDP to help young people with rheumatic conditions navigate entry into the labor market. And so in collaboration with Laurie's organization and several other patient-led organizations, we created this customizable tool. And so this tool was funded by CRWDP, and we integrated evidence as well as the content was co-developed by people with lived experience, as well as resources from trusted sources, which were identified by our collaboration with Laurie and other patient-led organizations. So I just want to quickly just show you this tool because I'm pretty excited about it, and it's just finally being launched. And so someone who will enter the tool will indicate to their current employment status. And based on their employment status, they'll receive some information, and they will answer specific questions, and they'll be given content that they can consider as they navigate the transition into the labor market. And so we've embedded resources throughout this specific tool, and we're excited for young people to engage with it as they enter their working lives, and they start to think about some of the challenges and opportunities that they might face as they transition from school to work. And so we're excited to showcase this, and I think it's a really good example of a resource that was developed in collaboration based on the needs highlighted by Laurie and her colleagues. So just to end, we hope that we've provided some level of a roadmap for collaboration that can be considered for research and people living with lived experience as they engage in research, and especially research on understanding and developing adaptations to work environments. So we're going to leave you there, and our contact information is on the screen, and we encourage you to reach out if you want to know more about our collaboration. And we thank you for tuning in today.
Thank you, Arif and Laurie. I know from my own work that the kind of collaborative process that you've engaged in improves the quality of the research and also improves the likelihood that the research will be put into practice. So I think it's really important, the kind of model that that you've used to work together in an integrated way. It's really great. And we're going to now turn to the live question and answer part of this session.